comes to assessing cognition or any situation in a person, there is always the question of what is objective evidence and what is subjective evidence. And that certainly is the case when you're trying to measure cognitive activity. Basically, is my opinion of my own symptom severity the same as the opinion of a healthcare team? Is it the same as another person judging the same condition within themselves? So subjective measures of cognitive activity fall into two categories, one being, as I said, self-evaluation, and the other being that of a professional, experienced person doing this work for a living. Self-evaluation of oneself is something we do all the time. You wake up with a sore throat in the morning, you make a judgment about its severity. In that case, if I had a scale to rate it on, I might say it's a 3. Somebody else will wake up somewhere else and rate their sore throat as a 4. Healthcare teams may rate both of us as 5s. The point is, the reliability of measures like this is poor. And the best example of how poor is now 4 to 5 studies have looked at a condition called vegetative state or unresponsive wakefulness syndrome. And those estimates of professional evaluation, subjective opinion of the patient in front of you, the error rates have gone up to as high as 43%. In other words, they have deemed the patient to be in a vegetative state, and 43% of the time they're wrong. Even a recent study by the people who developed the best test in the field called the Coma Recovery Scale, the revised version of it, they have found that the first pass with patients when they did their study was 36%. So as valuable as medical history taking is, any physician will tell you that she or he would never do without their blood tests or their EKG. And really, EEG and event-related brain potentials are effectively the blood test for cognition. We can provide objective evidence, not subjective opinion, not judgment. It's simply neural activity and what it's doing, and does it reflect certain cognitive failures and certain targets for rehabilitation, for example.